Hello guys, welcome back to my YouTube channel. I am Divya, CPC certified medical coder, and today I'm going to explain a musculoskeletal topic, that is arthroscopy. So, without any delay, we'll continue the topic arthroscopy. So, first of all, what do you mean by the arthroscopy? So here the word arthroscopy come from the arthro means joint and scopy means, that is visualization or looking the arthroscope, or we can say that visualization of the visualization of joint, and we can say that arthroscopy is a minimally invasive procedure which is used to look inside the joint using a small camera which is known as the arthroscope. So arthroscope is basically an instrument. So this arthroscope instrument is inserted through a tiny cut that is incision into the skin, and the small camera, that is the camera sends an image to the monitor so the surgeon can diagnose or treat the joint problem. So the common joint, we can say that here the knee, shoulder, hip, ankle and elbow. So uh, why this arthroscopy done? So arthroscopy is done to diagnose the joint problem and to treat the joint conditions. And the common reasons, we can say that the rotator cuff tear, labral tear, synovitis, debridement, loose body, and the shoulder instability. And it helps to reduce the pain, stiffness, swelling, and improves the joint movement. So, for the diagnostic purposes and the treatment purpose, arthroscopy is done. So, next. So we'll understand some small topic, that is what is meniscus, what is ligament, just for basic knowledge. So here meniscus is an crescent shape or the fibrocartilaginous uh, rubber that acts as a primary shock absorber within the joint, or we can say that like the knee joints, wrist joint, or the jaw, etc. So here the meniscus of the knee. Here is a meniscus of the knee, and in the knee there is a two cartilaginous pad inside the knee joint. That first one and the second one, which is known as medial meniscus and the lateral meniscus. So we'll continue what is medial and lateral. But here isn't basically tear in the meniscus, so it needs to be repaired. So basically, what is meniscus? Meniscus is an fibrocartilaginous crescent shaped pad which acts as a primary shock absorber within the joint. Okay. Next, ligament. So we previously discussed what is ligament. Ligament is a connective tissue which connect bone to bone within a joint. Okay, and there is four major knee ligaments. First, anterior cruciate ligament, which is present at the center of the knee, and the second, that is PCL, that is posterior cruciate ligament. Back of the knee is the location, and the third one, that is lateral collateral ligament, LCL, which is present outer side of the knee, and the next, medial collateral ligament, which is present inner side of the knee. Okay, and these just prevent the knee collapse inward, outward, and we can say that it preventing the bone from the sliding too far backward, or too sliding out front of the thigh bone. You can see here in the what is written here. Okay, next. So what is cartilage? In the picture you can see here, this one is an cartilage, and cartilage, we can say that it is an flexible connective tissue that protects the bone and joint, and it also acts as an shock absorber. This one is first and the second one bone, and this connects the joint, and between the joint there is an cartilage lining. Okay, so next, what is rotator cuff? So rotator cuff is a group of four muscles, and their tendons stabilize the shoulder joint to help to move the arm. So in the shoulder there are four major joints, that is four rotator cuff muscles, that is supraspinatus, infraspinatus, teres minor, and subcapsularis. Okay, so this provides the wide range of the motion, and these four muscles having their tendons, and this helps to stabilization of the joint, movement of the joint. It helps the movement. So next, synovectomy. So what is synovium? Synovium, we can say that the soft lining inside the joint. This one is synovium. Okay, and there is an synovial fluid. So the synovectomy, if there is and some condition, so that this lining of the joint not working properly, so that this procedure will be done, and it is an removal of the synovial completely or maybe the partially. So synovium, basically, what is synovium? It is a soft lining inside the joint. Now coming to labrum repair. So first, what is labral? So labral is a ring cartilage or around the socket of joint, which helps the joint stable. So if there is a labral torn in the labral torn, then what will there? There will be a surgical procedure will be done so that it will be repaired. So the labrum is the ring of cartilage around the socket of the joint that helps to keep the joint stable. So here is an example, soldier labrum. This is an ring cartilage you can see here. Coming to next, what is debridement? So previously we discussed what is debridement. Debridement means removal of the dead and necrotic tissue to prevent the healing. It is commonly done in the burns, wound ulcers, bone joint surgeries, arthroscopic procedures. The common joint for arthroscopy, we can say that knee, shoulder, hip, ankle, wrist, or elbow or finger. So there are many. So next. So what will physician do during the arthroscopy? What will physician do? So during the arthroscopy, physician will first give the anesthesia, and after that he will make a small cut or portal called portals, or inserts the arthroscope, that is camera, and pumps the sterile fluid into the joint for the better visibility. And the examination of the structures inside the joint. What were the structures? That may be the cartilage, ligament, synovium, tendons. Okay, and after that he will, if there is some problems in that structure, he will perform the repair or removal or reconstruction procedures, and then he will close the incision. Okay, now next. So basically the arthroscopic documentation, what document? First of all, before going to do the documentation, the requirements will be, first of all, in the documentation we'll see the which joint has been treated, and after that what is the laterality of that joint. For example, if there is a knee joint is present, then which knee joint, whether it is right or left knee or whether it is both. And the third one, diagnosis finding. What is the diagnosis? What is the, if what which joint is treated, what is the laterality, and what is the problems, what is the condition in that, so we have to find the diagnosis. Okay, after that, the what procedure has been given there. Then the technique used, which technique has been used, and the which structure has been repaired. Okay. After that, is there any implant or grafting is done or not? And the most important, the medical necessity. Now, before going to before going to do the OP report, we have to know the anatomy of the shoulder, knee, and the basic hip joint, and mostly. So first, the shoulder joint. The shoulder is formed by the clavicle. This one is the clavicle, scapula, and the humerus. And the main shoulder joint is the glenohumeral joint. Okay, glenohumeral joint. And a synovial ball and socket joint forms between the head of the humerus and glenoid cavity of the scapula, and it allows the wide range of the movement and stabilize the ligament and the rotator cuff muscle. So here the bones of the soldier. What are the bones of soldier here? So these soldier is made up of bone and joint and works together for the movement and stability. So the three bones here, the clavicle, that is an collar bone. This one is collar bone. This one is scapula, that is an soldier blade. And the third one, that is an humerus, that is an upper arm bone. Now, important parts. Important parts is the acromion. Acromion. This one is the acromion. Okay. So it is a part of scapula. This one is scapula. Okay. Forming at the top of the center. Okay. Now the coracoid process. This one is the hook-like structure of the scapula. This one is the scapula, and the hook-like structure is known as coracoid process. And the third one is glenoid cavity. This one is glenoid cavity. So here is a socket where the humerus bone shift or fit here. So this one is glenoid cavity. So this one is important parts. Another joint of the soldier. There are four joints: glenohumeral joint, acromioclavicular, stenoclavicular joint, and scapulothoracic joint. So this one is a glenohumeral joint. This one is a main soldier joint, okay, which is found between the head of the humerus. This one is humerus, and this one is the head of the humerus, and this one is a glenoid cavity. The scapula, there is an part glenoid cavity. This one. So between the glenoid cavity and the humerus head, there is an glenohumeral joint, and it is also known. It gives the wide range of the motion, and also called the ball and socket joint. Now the second one, that is an acromioclavicular joint, which is between the acromion and the clavicle. Acromion and between the clavicle and the acromion, there is a joint which is known as acromioclavicular joint. Now the third one, that is a sternoclavicular joint, which is between the sternum. This one is sternum and this one is clavicle. So between the sternum and clavicle, there is a sternoclavicular joint. Now the fourth one, that is scapulothoracic joint. The scapulothoracic joint is not a true joint, but it acts as a functional joint, and it is between the scapula and the chest wall. Okay, so this one is a scapulothoracic joint. Coming to next, anatomy of the knee. So there are bones of the knee. There are four bones here. The femur. This one is femur. This part is femur, which is an upper bone forming the knee joint and contains the medial and the lateral condyle. Now, the second one, tibia, that is, and the main lower bone contains the medial tibia condyle and lateral tibial condyle and tibial plateau. And the third one, that is an patella. This one is patella, which is an sesamoid bone within the quadriceps tendon and protects the joint and improves the extension power. And the fibula, which is present at the lateral to the tibia and provide the attachment for the muscles and the ligament, and it does not directly form the knee joint. So coming to next. So the largest synovial joint of the body is composed of three bones, that is femur, tibia, and patella, and the two articulations, that is tibiofemoral joint and patellofemoral joint. Okay. Now, the supporting structure is axial, PCL, MCL, LCL, and that is an meniscus, medial and lateral. So, axial, that is an anterior cruciate ligament, PCL, posterior cruciate ligament, MCL, that is medial collateral ligament, and LCL, that is a lateral collateral ligament. So, ligament just what is an supporting structure, and there is two meniscus, that is an medial and lateral. So basically, we can say that the knee, what knee is an, we can say that it is an synovial hinge joint forms by the femur, tibia, and patella, and contain medial and lateral meniscus, cruciate and collateral ligament, and synovial fluid for the smooth movement. And knee allow the flexion, extension, and slight rotation while providing the stability and weight bearing. Okay. So coming to the anatomy of the hip. So hip is the formed by the pelvis and the femur, pelvis and femur. And the hip joint is the synovial ball and socket joint formed between the head of the femur and acetabulum. Okay, head of the femur and the acetabulum, and it is supported by strong ligament and muscle and allow the movement in multiple directions. So these were the bones of hip, that is pelvic bone, which contains the three parts: ilium, ischium, and pubis. Okay, pubis is in front part, ischium is in lower back part, and the ilium is in upper broad part. The second one is the thigh, sacrum, and coccyx, tailbone. Okay. Now the joint of the hip, that is it's a type of synovial ball and socket joint and formed between the head of the femur and the acetabulum of the hip bone. And these were the ligament supporting structures of the hip, that is an iliofemoral, pivofemoral, ischiofemoral, and the ligament of the head of the femur. Okay. So this one is the anatomy of the hip and the knee and the shoulder. Similarly, in the elbow wrist and joint, we have to see the anatomy of that all. The main is that knee shoulder maximum. We get the knee shoulder and the hip joint. So that's why I have explained these all. But you have to know that all the structures and anatomy. Okay, at least bone and the joints. Now coming to the ICD and CPD. First, the ICD of the knee, shoulder, hip. So it is an S series code of the medial lateral, and the ACL tier S83511A synovitis, M series code chondromalacia, osteoarthritis, M17 series. For the shoulder, rotator cuff tear, impingement syndrome, SLAP, S series. So we'll see all these ICD navigation while doing the OP report. Okay. Coming to next, CPT, which is most important. So here is a screenshot of the book of the CPT, that is an first knee. So here's what is 29870. That is an arthroscopy knee diagnostic with or without synovial biopsy. And in parenthetical note, what is written: for open autologous chondrocyte implantation of the knee, we have to use 27412. So we can say that it is a procedure where the we can say physician will use or surgeon will use a small camera that is called arthroscope or instrument arthroscope to look inside the knee joint and to diagnose the problem, as it is undiagnosed, to diagnose the problems. So why this procedure has been done? To find because of the knee pain. If a patient having the knee pain, synovitis or inflammation in the synovium, or there is some ligament injury or some cartilage damage or etc., so that physician will do the arthroscopy. Okay, so he will create the small incision. Okay, or we can say that the small incision or portal, and inserts an arthroscope to the knee joint and examines all compartments. For example, knee. So the knee compartments are medial, lateral, patellofemoral, and the axial and the pezial region. So he will examine all that compartments while inserting the arthroscope. And after, so we can say that simply that is a diagnostic arthroscopy of the knee, where the surgeon visualize the joint or knee joint using an arthroscope with or without synovial biopsy. Whether it may be synovial biopsy will be there or without synovial biopsy. If there is a with synovial biopsy, then also 29870. If without synovial biopsy, then also 29870. Okay, only diagnostic purpose, and it is a separate procedure, single procedure. Okay. Now coming to 29871. Okay, 29871, what it say? Arthroscopy of the knee, surgical for infection, lavage and drainage. Okay, So this one is not a commonly used primary knee arthroscopic code in the standard CPT. So it is a non-primary procedure. So we can say that this one is diagnostic and this one is surgical. For any infection in the knee, he will do the arthroscopy. Okay. So and here parenthetical note is what? That is an 29871 in conjunction with 27369. We do not have to use this procedure along with this CPT code. Okay. And uh, coming to next, that is an 29873 procedure, that is an with a lateral release. So here how we read that: arthroscopy knee surgical with lateral release. Okay. So here lateral release means what? So here the procedure when surgeon will cut or release the tight tissue on the outer side of the knee or the patella or the kneecap, or called the lateral reticulum. Okay. So why this procedure is done? Because of some lateral compression syndrome or some pain. Okay. So this one is a therapeutic procedure, as it is named that surgical. It is not diagnostic. So this one is surgical procedure, arthroscopic knee surgical with lateral release. Okay. And what is parenthetical note? For open lateral release, we have to use 27425. What is here? For the open lateral release. Okay. This one is 27425. And this one is simply arthroscopic. This is an open lateral release. Okay. So the next one is 29874. Wait. So in the 29874, what is here? The arthroscopic knee surgical for the removal of the loose body or the foreign body, example osteochondritis, dissecans, fragmentation, chondral fragmentation. So what is the meaning of that? It means surgeon will use a small arthroscope camera inside the knee and removes the small broken piece like the cartilaginous fragment, bone fragments, meniscus pieces and the foreign material. Okay. So when it will be done, when there is an like injury, meniscus tear, cartilaginous damage or degenerative knee diseases, so that the surgeon will incise and made incision will be done, and the small camera, that is the arthroscope, has been inserted, and the joint is inspected and the loose body are identified and the removed using the instrument. Okay. So simply it is an arthroscopic removal of the loose body, foreign body from the knee joint, where the fragments of the bone or cartilage are extracted using the minimally invasive procedure, that is an arthroscopy. Okay. So coming to next, that is an 29875, that is most important procedure, that is an arthroscopic surgical synovectomy limited, example plica or self resection, and it is a separate procedure. So what is the synovectomy? That is a removal. That is a removal of the synovium. So basically here it is unlimited. What is the meaning of the limited here? What is the meaning of limited? So the limited means there is a single. If for example synovectomy knee has been done, it means there is a single compartment will be there. Okay. Removal of the synovium along with the arthroscopy using and there will be a single compartment. Okay. like inflate synovium will be there, limited or the synovial tissue has been performed. Okay, it is a separate code. Okay, and it is an such as a plica or self resection. So limited synovectomy means single compartment will be used. Okay, and 29876 arthroscopic knee surgical synovectomy measure, that is in two or more compartment, medial or lateral or more than that. Okay, so in the knee there is a compartment, that is a medial, lateral and patellofemoral. Okay, so if there will be a more than two compartment, then it will be a synovectomy, arthroscopic knee synovectomy measure. Okay, now coming to next, that is 29877, that is an debridement saving of articular cartilage chondroplasty. Okay, arthroscopic knee surgical with the debridement of the articular cartilage chondroplasty. When performed with arthroscopic meniscectomy, see the 29880 and 29881. Okay, what is the parenthetical note here? So while meniscectomy is done, so meniscectomy arthroscopy is done, we have to see that procedures. Okay, 298 double, we have to see that whether this perform or not. Now the second one, now the 29879, that is an arthroscopy knee surgical abrasion arthroplasty including the chondroplasty where the necessary or multiple drilling or the micro fracture will be there. Okay. Similarly, in the 29880 and 29881, most important, that is an arthroscopic surgical knee with meniscectomy, medial and lateral, including any meniscal saving, including debridement, saving or articular cartilage, same or separate compartment, unperformed. It means that here is in both compartment has been used. Okay, medial and lateral. If any, now the 29881, that is a mixed meniscectomy, medial or lateral, including any meniscus, including debridements, articular cartilage, same or separate compartment when performed, it means they are medial or lateral. So difference is here and or. So here and means both the compartment will be treated here, will be removed. Meniscectomy means both the compartment has been removed. And here medial or lateral means any of one them. It means either medial or either lateral. Any single has been removed. Okay, and what is here, that is in the 29870, what is written there? Debridement. So can we code this debridement along with meniscectomy here? No, because here it is included. It is included debridement, saving of articular cartilage, same or separate compartment. Okay, for the same compartment, if the debridement along with meniscectomy is performed, then we cannot code this code along with this code. Only single code will be there. Okay, and if there will be a separate compartment, separate, then we can definitely code. Okay, we can see in the, we'll see in the navigation and we'll see in the OP report. Now it is a meniscus repair 29882, that is arthroscopy knee surgical with the meniscus repair, medial or lateral. Now 29883, that is an arthroscopic knee surgical with meniscus repair, medial and lateral. Same rule. Medial and lateral means both the compartment has been repaired, and medial or lateral only single compartment has been repaired. Okay, for medial transplantation, medial or lateral, we use 29866. 29884 with lysis of adhesion, arthroscopic knee surgical with lysis of adhesion, with or without manipulation, single procedure. Okay, so these were the CPT. Okay, here 29885, that is an arthroscopic knee surgical drilling for osteochondritis dissecans with bone grafting with or without internal fixation, including debridement of base of lesion. And 29886, similarly drilling or intact osteochondritis dissecans lesion and 298,887, that is drilling or intact osteochondritis patients lesion with internal fixation. So these were not a complete code, okay? These were not complete. Along with this, what is there? There is an arthroscopic surgical knee. After that, we have to add this. Okay, so this one is an arthroscopic knee CPT. Coming to next, soldier, that is 29805, that is an arthroscopic soldier. Similarly, like we have to read like that, arthroscopic soldier diagnostic with or without synovial capsulorrhaphy 298706 and 29807, that is repair of flap lesion 2981, 29819, that is removal of the loose body of foreign body open. We have to see that procedure. So along with these procedure, we have to see the parenthetical note also. Okay, and arthroscopic soldier 29820, that is synovectomy partial, and for synovectomy complete. Okay, 29822, that is a synovectomy limited or one or two discrete structures. So limited means there will be a one or two discrete structure. What this discrete structure? These were the humeral bone, humeral articular cartilage, glenoid bone, glenoid articular cartilage, biceps tendon, biceps anchors, complex labrum, and these were the whatever the written here. Okay, if any one of them having the one or two discrete structure will be there, then it will be a limited debridement 29822, and 29823 if there will be a three or more discrete structure. So here is an example written, that is humeral bone, rotator cuff, labrum, articular capsule, bursal side root, and the subacromial bursa, foreign body. So along any one of these are three or more discrete structure will be there, then it will be an extensive debridement. And for the open procedure, we have to see specific open soldier procedure performed. 29824 distal clavectomy, including the distal articular surface Mumford procedures. Open, we have to see that one. And so these were the procedures of the soldiers. Okay, coming to next, hip. That is an arthroscopic hip 29861 series, surgical with removal of loose body or foreign body with debridement. Okay, it is an arthroscopic hip surgical with debridement, saving or articular cartilage. So these were the CPT code. Okay, so coming to next, arthroscopic guidelines, we have to know that the diagnostic arthroscopic rule, that is an which is included in the surgical arthroscopies, which is performed in the same joint or not separately billable use. It means that, for example, in the arthroscopic diagnostic arthroscopic will be not coded with the major procedure. Surgical arthroscopic already include that diagnostic arthroscopy. For example, this one is a meniscectomy code, okay, 29881 meniscectomy code. And this meniscectomy code includes the diagnostic arthroscopic procedure. For example, 29870 is an arthroscopic diagnostic, and also the meniscectomy done. So can we code these two codes? No, we can't code these codes because this 29881 is a major procedure already includes the diagnostic procedure. Okay, so we can't, we have to check that the main procedure, that is an major procedure, includes diagnostic or not. So major procedure includes the diagnostic arthroscopic. Okay, surgical arthroscopic includes the diagnostic for the same joint. Okay, for the different, we definitely code along with this. Now second, that is an debridement bundling rule. Soldier, for example, soldier. Okay, so it's in 29822, that is an limited debridement, and 29823, that is an extensive debridement. We cannot code these two procedure, okay, along, will together, cannot be coded together. Okay, and debridement may be bundled into the rotator cuff repair, slap repair, unless the different structure. So already we discussed the what is limited debridement and what is extensive debridement. It means the single structure will be there. Single structure has been treated, and the extensive debridement, single and more than two or more, three or more disc structure will be there. Okay, coming to next. Knee chondroplasty rule 29877 is usually bundled with the meniscectomy, acromioclavicular ligament, ACL repair, and they cannot build separately only if the different compartment documented. Okay, so this one is already bundled in this meniscectomy, which is an the major procedure already includes the 29877. Okay, it cannot be built along with this. Okay, so this one is the knee chondroplasty, and this chondroplasty code cannot be coded with the meniscectomy code because it is already included in the meniscectomy. But if there is a compartment is different, then we can code this two code. Now coming to synovectomy rule, limited versus major. In the synovectomy 29875 limited and 29876 major, it means for example in the knee, there is a three compartment. Okay, so if there will be a one compartment will be there, okay, one compartment will be there, then it will be 29875 limited. If there is a two and more than two compartment will be there, then 29876. Okay, so need clear documentation of compartment has been treated. Now meniscectomy and meniscus repair. Repair and removal in the same compartment cannot be separately billable. For example, if there is an same compartment in the lateral compartment of the knee, the repair and removal has been there. Then this repair and removal code can't be codable. Only one procedure, the major procedure, has been reported. Note here, debridement limited. It means 29822 code means one or two structure. What this structure will be the labrum, synovium, cartilage, glenoid, rotator cuff tear, rotator cuff tendon, biceps tendon, humeral head. The second one, debridement extensive, that is 29823, means three or more structures. It means three or more structure, these three or more structure. These were the structures written here. Now the third one, lysis of adhesion, synovectomy, loose body removal. These codes, the CPT code, lysis of adhesion CPT code, synovectomy CPT code, and the loose body removal CPT code. If performed with any of the major procedure, then these three procedures not be codable. Okay, any major procedure. For example, if meniscectomy is done along with synovectomy or the loose body removal, meniscectomy is an major procedures cannot be codable. So these procedures cannot be codable with the major procedure. Okay, main thing. Fourth one, extensive debridement. Extensive debridement can be coded with the major procedure if there is no edit or some certain conditions. For example, if debridement performed on the different structure from the main procedure, then we can code. Now, based on the anatomical structure or reason, there is different compartment. So, in the synovectomy, there is limited and the major. So, if one compartment means limited, two compartment or more compartment means major. So now we'll see the navigation of the OP report one by one. Okay. So here is a pre-operative diagnosis, that is an left shoulder rotator cuff tear, post-operative left shoulder rotator cuff tear, and the procedure is left shoulder arthroscopy with rotator cuff repair. Procedure note is the patient was brought to operating room and given general anesthesia, and the left shoulder was prepped and wrapped in sterile fashion, and the arthroscopy was inserted to the standard portals. Examination showed rotator cuff tear. Arthroscopic repair was performed using suture anchors, and the joints were irrigated, instruments removed, and incisions were closed with the sutures and the sterile dressing applied. The patient tolerated the procedure well without complication. So here what is done? There is an rotator cuff tear. Okay. After the arthroscopic examination, what is there? Rotator cuff tear is there. So this tear should be repair. So here repair is performed using the suture anchor. So here is a left shoulder arthroscopy with rotator cuff repair. So here the rotator cuff repair in code will be the major procedure. We can't code the arthroscopic code, diagnostic code. Okay, so we'll see the navigation of this. Okay, it's on late. Okay, tear. So tear, rotator cuff are then specified. It's on right side, not wish to code more. Okay, M75101. Okay, so this one is an ICD. Now the CPT. What is CPT? That is a rotator cuff repair. Okay, repair rotator cuff. It's an arthroscopic now. It's an arthroscopic. So it's an arthroscopic. No biceps stenosis. Nothing is there. So without and specified. It's in right side. Okay. So it's in 29827. It's in right. It's on left side. So we'll give the modifier. We'll give the LT modifier. Okay. So this one is an I remove that LT and code will be different. Okay. Again here rotator cuff left side, not wish to code more. So this one only this change. Okay. So this one is a navigation of the knee arthroscopic, shoulder arthroscopic. Coming to next, that is an hip arthroscopy. So here's an diagnostics. Diagnosis is right hip labral tear and the uh, that is an right hip labral tear with the FAI, that is an femoroacetabular impingement, and the procedure is right hip arthroscopy with labral repair and the femoroplasty, and the anesthesia general anesthesia. So operative report, what is saying that description, the patient was placed in supine under the general anesthesia, standard arthroscopic portals were established, and the diagnostic arthroscopic revealed an anterior superior labral tear and cam type femoral acetabular impingement, and the torn labrum was repaired using a suture anchor, and the femoroplasty was performed to reshape the femoral head neck junction and eliminate the impingement, and the joint was irrigated, instrument removed, and the portal closed. The patient tolerated the procedure well and was transferred to recovery in the stable condition. So here, what a physician, what is the diagnosis? Diagnosis is labral hip tear with FAI. Okay, and here what a physician has done. So here's an for the labral repair, using sutures and anterior. Here the diagnostic arthroscopic revealed that there is a labral tear. So cam type femoroacetabular impingement and the torn labrum was repaired using the suture anchors, and femoroplasty was also done to the reshape the femoral head neck junction and eliminate the impingement. Okay, so we'll see the navigation of this one. So first, labral tear of the picture, that is an side. Other specified because and what is a side, that is in right side mesial. So this one is then S73 191, that is an code for the right hip labral tear. Okay, now coming to the impingement ICD, that is an impingement joint, hip joint is there, so we'll see the hip joint right side northwest to Podmore. So this one is an ICD for the FAI. Okay, coming to the what is an CPT. So there will be a two CPT because the two CPT separately perform first femoroplasty and the labral repair. Okay, so first repair of the first joint. Okay, which joint? Hip joint. It's an arthroscopic. Yes, it's an arthroscopic. Okay, and any another procedure is done? Yes, femoroplasty is also done. After the arthroscopic, normal procedure done. Why it's coming? That's why it's coming. Repair of joint. It's in joint, na? Labrum repair. Okay. Sorry, guys. Repair. It's in labral repair. That's why it's not coming. Labral repair. Okay. Labral repair. Any reconstruction? No. Other specified. Okay. So no more procedure. 9916. Okay. Next, another procedure is femoroplasty. Femoroplasty. Arthroscopic. So this one. So these two procedures will be there. Okay. Arthroscopic hip labral repair, arthroscopic hip surgical, femoroplasty, that is in cam lesion resection. Okay. So this one is an navigation of the hip arthroscopic procedures. Coming to next, that is an knee. Now, the bilateral knee pain suspected medial meniscus tear, and here's the next post-operative medial meniscus tear on right and left knee, and procedure performed, that is a bilateral diagnostic and therapeutic knee arthroscopic with partial medial meniscectomy. Okay, procedure is patient bowed to operating room and placed in supine position. After administration of anesthesia, the both knee were prepped and wrapped. Standard arthroscopic portals were created in the knee, and the arthroscope introduced subsequently into the right and the left knee joint. And diagnostic arthroscopy revealed the medial meniscus tear in the both the knee and the partial medial meniscectomy. Debridement was performed using the arthroscopic saver and the basket forceps, and joints were thoroughly irrigated and portals were closed and suture stay strips were dressing applied, and patient tolerated the condition and the recovery in a stable condition. So here the diagnosis is medial meniscus tear for the right and left knee. Okay, there is single compartment that is medial and both knee were included, and here the partial meniscectomy has been done. Okay, so we'll do the navigation of the ICD here, meniscus, other, lateral, and it's on right side, initial, for the medial also, right side, not code move. Okay, so this one is an ICD for the lateral and meniscus, okay, for the right knee. Okay, now coming to the, there is an therapeutic procedure. What therapeutic? The partial meniscectomy has been done for the both the knee. So meniscectomy procedure for the knee, arthroscopy, medial and lateral. No, there is an only medial side. So for the only medial, we'll give the or only lateral or. So here is an only one. So 298881. So this one is an medial meniscectomy for the both the knees. So again 29881 for the right side. One for the right and the another for the left. So here modifier RT, it's slow. So here is an RT and LT, and for the meniscectomy lateral side, right and left. Okay. Okay. RT modifier LT. For the ICD also, here is an lateral meniscus. Okay. So here is an only the medial, na? So only medial. So here tear, tear, meniscus, other, medial, medial side, other, only right. Okay. And similarly for the left also we have to take that. Okay. It is for the right, and for the left we have to that one is the navigation. So this one is an S83 241 and 242, right and left. Okay, and this one is an RTLT modifiers. So this one is an arthroscopic procedure. So next we'll see the arthroplasty. Okay, so that's it guys for the today. Like and subscribe.